The rollout for Pfizer's COVID-19 vaccine is now in full swing. Healthcare workers across the country were among the first Americans to receive the shot this week, and there's hope a second vaccine by Moderna could be approved very soon. This comes as deaths and cases continue to spike. The U.S. is recording more than 3,000 new deaths each day, and hospitals are nearing capacity, if not already at it. For more, I'm joined by CBS News senior foreign affairs correspondent and Face the Nation moderator, Margaret Brennan. Margaret, thousands of people have been vaccinated this week, but some states say that they'll be getting fewer doses in the second week of distribution. Tell us, why is that?
This is a huge public debate right now with a lot of finger pointing, and I feel like we're going to see a lot more of this in the weeks ahead. It depends on who you believe. Pfizer, who's making the vaccine that's currently available, says they have doses sitting on shelves that the U.S. government is not even asking them to ship out. Health and Human Services, which is running this and overseeing Operation Warp Speed, says they have different information in terms of their computer systems about what is available, but they have decided not to ship everything they have out, to hold some back as a reserve supply. Not clear why, if it's already manufactured, why they think they need that cushion, but that's what they say. Then the Health and Human Services Secretary has said, well, it wasn't him anyway, it was the general in charge of the logistics who made the call. But this has left governors in states who were using these data and logistics computer programs with Operation Warp Speed totally confused, because they say, look, you guys told me one number 1 week and then you cut it dramatically the next. Where is reality? Because you are giving false hope and you are causing problems with planning and rollout of the vaccine. So this is going to be really sticky. And right now, keep in mind, we're on the easy part of this because we're only talking about giving it to hospitals and to clinics being run in nursing homes. We haven't yet talked about rolling out to the general population. So we're going to dig into this, hope to, on Sunday. But this is clearly a bit of a public policy mess. And the Trump administration says, look, this is ultimately up to the states. We're giving them what they can get, and it's up to them to make the most of it.
It's so disheartening to hear this finger pointing. And as you say, Margaret, they're leaving it up to the states. So how are the states affected preparing to handle this?
Well, you had all these public comments from Governor Inslee out in Washington State and Michigan, Governor Whitmer saying, basically complaining in public, saying this isn't right. But ultimately, they're also complaining because they're the ones who will get blamed by their constituents for not being able to force the government to help them figure it out. So this is where we are. It's a bad situation, and this is how it's going to be over the next few months unless the administration can help unstick some of this. States also are saying they need money to help roll out the vaccine. Keep in mind, a lot of these governors, and I've heard this from members of the COVID task force, I'll say, they're concerned that a lot of these governors are stretched pretty thin right now because they're already dealing with trying to figure out testing in their states. They're already dealing with economic problems, and now they have to figure out how to roll out the vaccine to their own constituents without the level of federal support they say they need. So this is going to be a story that stays with us. We're going to have some details on Sunday's program. Dr. Scott Gottlieb, the former FDA commissioner, will be with us as well.
Well, as you say, Margaret, this is really the easy part because this is really that targeted group. But according to a Pew Research Center study published this month, 2 in 10 Americans say that they do not intend on getting vaccinated. As you know, it is essential that that as much of the population as possible buy into vaccinations and actually get it done. So how are our governmental leaders working to try and combat disinformation and misinformation?
Well, it's interesting to try to talk to voters, as we did last week, to ask in our focus group, why are you hesitant, and to hear some of the reasons why. And keep in mind, some of this hesitancy has nothing to do with politics or this particular vaccine. Some of it pre-existed our current crisis. Some of it is specific to the Trump administration's plan here to really grease the wheels to speed this vaccine approval through in what is the fastest vaccine approval process in Western history. So that's what the administration is up against right now. But keep in mind, the Trump administration is only in office for 30-odd days. This will be the Biden administration's problem come January 20th at noon. So this is something that is going to have to be communicated publicly to demonstrate to people that it is safe, and some of that may just come with time, frankly. You know, we saw the vice president get vaccinated and the surgeon general, who will be our guest on Sunday, get vaccinated on camera. They're hoping more celebrities will do that, prominent people. We've seen congressional leaders do it. All of that, hopefully over time, will help assuage some of these concerns, because if they don't get a substantial percentage of the public, about 70% of it or so, this won't help really stop the spread of COVID.
Absolutely. And I did love that panel of real people that you've been talking to. I hope that you'll continue to check in with them, and we'll see how perhaps these attitudes do shift with time. All right, Margaret, I want to switch gears and talk about the recent cyber attack on several U.S. government agencies. Authorities suspect that Russia is to blame. We're now learning that the attack is more serious than previously thought. Tell us not only what's the latest on this, but how has President Trump and President-elect Biden responded to this attack?
This is hugely significant. Every cyber expert I have spoken with tells me that this is by far the hack of the decade, if not the century, that this is the largest cyber attack on the United States to date. And they say, take cyber out of it. Imagine we're just talking about espionage, plain and simple. This is the equivalent of putting a top spy in every single sensitive department of the United States government. Everything from where we watch our nuclear stockpile, to the Pentagon, to the State Department, to the Treasury. It's also hit U.S. businesses, and it is so widespread, and that is part of the problem. The federal government says right now that this is ongoing. They don't yet know the extent of the attack. The first group to even acknowledge that this attack was happening was a private company, not the U.S. government, private company called FireEye, and their CEO is going to join us on Face the Nation Sunday to tell us how they figured it out. Now they suspect that it was a nation state, that it was a country. Russia's widely believed to be that country. But for the Trump administration or the Biden administration to officially come out and say it, they have to have the proof, because this is so massive in terms of the breach here that it really demands some kind of national security response. And the Trump administration's been largely silent. The president has not addressed it or acknowledged it in any way. Neither have his top national security advisors. The defense secretary did say to our Catherine Herridge that it happened, but that it was limited. And that's pretty much all we've heard. The president-elect, who has been briefed, seemed to indicate he thought it was Russia, and said that the price paid would be in the form of a financial cost that I assume means sanctions. But we already have congressional hearings being scheduled for the new year. This is going to be a story that stays with us for some time.
I'm very interested to see that interview with the CEO of FireEye. Margaret, what else is on tap for this weekend on Face the Nation?
I feel like I'm just inundating you with crises here. But we'll be looking at the latest on Capitol Hill. As we know, there are these impending deadlines for financial relief for Americans. The expiration of some of those unemployment benefits for contract workers, for example, is looming the day after Christmas. We want to look at the financial cost to everyday Americans if Congress can't get this deal done in the next 24 to 48 hours. And level set here, because we want to know, should you expect further job cuts in 2021? We're going to do that with Mary Daly, who is one of the top labor economists in this country. She's head of the Federal Reserve of San Francisco, and she's going to helpfully, I think, walk us through what she is seeing happen in the U.S. economy right now.
A lot of crises, but also a feeling, I think, that maybe a little bit of relief is on the way. All right, Margaret, thanks for joining us.